My name is Dr. Ekore John Robert. I'm the medical superintendent of Kapchorwa Hospital. I've been here for some good time. I must take this opportunity to welcome you again to Kapchorwa. Yes, for this very important activity where we're inspecting the projects that are being done by the Updf Engineering Brigade. Yeah, the Updf Engineering Brigade has been here since mid last year when they were given a contract to construct the oxygen plant for Kapchorwa Hospital and also to construct the theatre, for the operating theatre for the hospital. The project entailed construction of, as I said, the oxygen plant plus also a generator house that is going to power that oxygen plant. So the project has been there so far. They have finished 12 months since it was handed to them. And the structures that are already in place here is we already have a generator house which is already in place. We also have the oxygen plant house that is already in place. Then we have the theatre. The construction was supposed to be done in phases, phase 1 and phase 2. In phase 1 we're supposed to have completion of the oxygen plant, then plus the phase 1 of the theatre. Phase 1 of the theatre included construction up to the roofing level. The rest of the internal fixes and the finishings are to be done in phase 2. So far as we speak, the oxygen plant is almost complete. According to the engineer in charge, he says we're about 80% with the oxygen plant. The only thing left is the installation of the components for the oxygen plant. The generator house is also almost complete. It's only just left the installation of and the wiring only left so far for the oxygen plant. The theatre they have done so far phase 1 up to roofing, as we can see around.
Lieutenant David Tracy Gomwe, the site engineer here at the Kapchorwa General Hospital. We are doing construction of the oxygen plant, the powerhouse, and the maternity ward. Actually, we are doing it in phases. So the powerhouse, it is at 98%. The oxygen plant is also at 98%. Then the theatre is also at 99%. So we are doing it, the theatre we are doing it in phases. The phase 1 is almost done, as we have had the progress.
Previously we have been having a challenge of space, especially the theatre, where the theatre is small. The one we have been operating and the one functioning now, it is small and it can only take one patient at a time. So yet the population is big here in this region. The population comes as far as the neighboring districts. There is Buko, there is Kwen, then we also have Bulamboli, and sometimes this side of Amudat. So all that population gives pressure to our theatre services. So you find there is a queue of patients who need to be attended to from theatre. So you know, when there is a queue, there are emergencies, there are certain things that will definitely happen. Fatalities are likely to happen. So with the coming of this theatre, which is big enough to accommodate more than one patient at a time, the public really should celebrate, and as a hospital we are really very appreciative to Ministry of Health and Government of Uganda and UPDF, who are now constructing the theatre, that they are giving us a special theatre that is going to match the demands of the population.
We started here the construction on 27th July 2023. The duration of this project was 6 months. We are progressing on well. The total amount of this project was 977 million Uganda shillings. People here in Kapchorwa, they are cooperative. We are cooperating with the community, and actually we have employed the people in the community. They have got jobs, and majorly we are doing it for our country, so that the country is at greater heights. Thank you so much. I thank our President, His Excellency General Yoweri Kaguta Museveni, for entrusting and empowering UPDF Engineering Brigade, and UPDF in general. We thank you.
Yeah, it has been a very great time working with the UPDF. Of course, initially when people hear UPDF, they think these are tough people, but from our working relationship with them, they have been very, very professional. The team that has been coming has really been very, very professional. We have been sharing a lot with them, a lot of information here and there, progress of work. We've been having, initially we used to have monthly site meetings where a team comes and we review the progress of the work. So our working relationship basically has really been good with the UPDF people. We have not had any major challenges with them. Yeah, it has really been really good. The team has been so professional, and we want to thank the UPDF team for their high level of professionalism. We are really appreciating.
So what we all need to do now is to increase the staffing of the theatre to be in position to meet now the requirements of the modern theatre, which is big. Now our population will be served much more conveniently. When you come to the oxygen plant, the oxygen here, you know, it is a very important medicine, and it is part of emergency. When someone wants oxygen, is in need of oxygen, just know that is an emergency. And previously we've been having a very big challenge where sometimes the regional oxygen plants, say those other ones in Bale, Soroti, even Jinja and so on, the ones we could easily go and get oxygen. When sometimes they are down, we have a deficit of oxygen, and also the distance. We have to go there and bring the oxygen, so it doesn't meet the timing of patients when they come here. Now with this oxygen plant where we are now going to produce our oxygen here, emergency service is now going to improve to the patients. Now it will definitely reduce on the treatment time of our patients, even those ones now coming from Buko, coming from Kwen. Our patients, their time for attention is going to decrease. They will be coming here. We have oxygen, a little bit more reliable than before, because even now currently we have to rely on NMS. Now they are the ones who are bringing now for us oxygen, so we have to communicate to them ahead of time so that we receive oxygen in time. But once we have our oxygen, all those bureaucracies are going to reduce. We will no longer be communicating to NMS that we want oxygen. We just go there, produce the oxygen, have our cylinders filled. The patients are getting the oxygen. And then we're also going to reduce the pressure of our regional referral hospitals, Bale and so on. So in a way, it's going to affect in a positive way emergency services at even national level, especially from this region. We're now going to handle this region. So this basically, this facility has come at the right time.
We found the area when it was bushy, and first of all we had to do landscaping, we had to do leveling so that we get levels, so that we are able to do setting out precisely and very good.
Then the stage 2?
The stage 2 we had to do setting out, then we started excavation of trenches, and of which now we had to do the slab so that we prepare for the superstructure. From day one, the community were so happy to receive Updf Engineering Brigade, and they had trust in us, of which we are also promoting. They are so joyful people here, of which we are cooperating with, and we are still cooperating together. Actually, we came here, the first team we are 35 from Updf Engineering, then we had to mix the community, more 20 people, so that we do the project quickly, and we achieve the duration that was set. Actually, most of the local materials we have been getting them from around, and people have appreciated, they have supported us, and we are moving together with them.
Now, go back to how important these structures are. The oxygen plant is going to help us generate oxygen, medical oxygen, of which we know, of course, medical oxygen is a drug. Oxygen is medical, we consider it a drug that is very necessary for people with a number of conditions, even including people with accidents, people with lung diseases, people with heart diseases, and other conditions, severe anemia. All those conditions can be supported with oxygen. I remember during the COVID-19 time, we had a lot of challenges with oxygen, because of course we couldn't access oxygen here, and even after that, you know, for us, we'd get oxygen from Mbale, we'd go to refill, and it would cost a lot. And when you go to Mbale, very many facilities are also going to Mbale to refill oxygen. Sometimes the plant is down, we go to Soroti. So it had been a challenge really getting oxygen for the people. Of course, in between there, NMS came along where they would help us refill the cylinders, but still it would not really be that sufficient. But now that we shall be able to generate our own oxygen from here, I see it is going to go a long way to address the challenges of oxygen scarcity, and our people are really going to benefit. Emergency cases will be easily handled because now we shall have oxygen in place. So it's a very, very good move by the Ministry of Health. Then the theatre. The hospital has grown over time. Of course, this is a hospital that started around early 1960s, but over time the population has grown, and so even the needs of the hospital have grown. Currently we still have one theatre with only one operating room, which cannot be sufficient for the needs of the people. And I want to thank Ministry actually for considering Kapchorwa Hospital to benefit from the operating theatre. The operating theatre that is here is going to have two different operating rooms, one dedicated for obstetric cases, those are for women, issues to deal with cesarean sections and that. So it is going to be quite good because it's going to reduce the delays, because initially in the theatre that we currently have with only one operating room, when already there's an operation going on, and say for instance you have a lady with obstructed labor, you could not handle that fast. But now with the theatre that is coming in, we can be able to carry out two operations at the same time. So it's more of a modern theatre, and it's really a very big theatre. There are going to be offices for the surgeons, the anesthetists, and basically it's going to fasten our response to emergencies, and it's going to reduce the delays in patients accessing emergency surgical services. Yeah, and it's going to help us to move towards a specialization within the hospital. Thank you. Yeah.
You know, as a hospital, we have a number of priorities, and this is one of the key priorities. We are now just encouraging government and the UPDF to fast track implementation of this facility. Especially now, key for the equipments, we need the transformer to be installed. We need the electricity to be fully installed so that our equipments are not going to be at risk of destruction by electricity. And it is also one of the items we have been crying for a very long time, the transformer. The one that is serving the whole district also serves the hospital, but of small capacity. So we have been having those power outages. Now with this facility, this project, when it came, it is also coming with the transformer. Something we have been asking for a number of years has come to fruitful at this time when the project is being implemented. So we just pray for its fast completion and we utilize the service.
Currently we have had very good facilities that are still ongoing, and that's the oxygen plant and the modern theater that is still being worked on. As you are aware that all along, like for example, during the time when we had COVID, we needed a lot of help, support from the hospital in terms of oxygen and many other things. But Kapchorwa General Hospital used to go to Mbale. If you go there and you don't get, they would even go to Soroti and even as far as Jinja. But currently when all this is done, it will be a lot of support and a lot of privilege for the region and the neighboring districts. So we still continue to ask government to help us in fund additions so that we can facilitate and finish up the theater that is still being worked on. As well, we want to appreciate also the Uganda People's Defense Forces Engineering Brigade for the work they are doing. It is tremendous. We have seen a lot of work being worked on, a lot of quality work being done here, and it is of our happiness that we ask government to continue doing the same thing. There are a number of issues that we still ask government to help us as a general hospital. You know, this is the hospital that serves almost 6 districts down here. And initially when it was put here, we were only supposed to treat patients around 300 in a month. But currently we hold over 2,000 patients in a month. When you go to the OPD, it is even becoming very small. Because by then it was just a hospital for, one constituency. But now it is holding over 6 districts. So the hospital OPD ward is becoming small. We do not even have enough space for even casualties. As you are aware, we are living in a mountainous place. As from the beginning, I talked about how this project, like the other theater, which was phased, the first phase is done. Then we are coming up with the second phase, of which we are yet to begin. So for the oxygen plant, it is done. It is done, waiting for the installation of the machine, the oxygen plant, which is going to be done by the Ministry of Health. And the power plant is also done, waiting for power connection.
Then, when you
my last message to the top leadership of the engineering brigade of UPDF, we appreciate the work you have done for us, especially even the quality and being available to monitor the project, because at least you have resident engineers here who monitor the work. We are very appreciative of the stakeholder engagement, because you have involved us at every stage of this implementation of this project. We've been having stakeholder meetings where we come to the site, we supervise, we identify, we give you our opinions, and you take them, you implement. So we really appreciate. We want you now to continue being more closer to us, because we have more other priorities. We even have the maternity ward that needs expansion. You know, it is now housing maternity itself, and then NICU, the neonatal department. But ideally it was just planned for maternity services. But because of the need, we now have niche there. So as you engage with the government and other stakeholders, just know that Kapchorwa is still in dire need of other services in their priority list. The maternity needs expansion. We need also the casualty. The sewage system of the hospital needs an overhaul. MOH has come a number of times to assess, and they have put the figure at more than 500 million. So as a hospital, we cannot handle those things alone. I know you people get money from government. Please work with the government, collaborate with us, and we see how we even get more services to Kapchorwa Hospital, so that we help our population and impact on quality health service delivery at national level.
Daily as a hospital, at OPD on daily basis, we see not less than our daily OPD attendance is not less than 500 people daily. That is just people who come for OPD services. However, that number does not include the people who come for other services like specialized cases like HIV services. Those ones are different situation altogether. But overall daily, it's not less than 500 people who attend our OPD. And of course, commonly, the common conditions have been the infectious diseases. And when we talk about the infectious diseases common around this place, even malaria is on the increase. We have these diarrheal diseases around, the pneumonias, the respiratory tract infections. But however, what we're also observing as a facility is we are seeing a trend where there's increase of non-communicable diseases. Actually, we're noticing maybe because of the change in age structure, we know we have quite now a number of old people who are living for long. So there's a number of those chronic conditions, cardiac diseases, heart diseases also on a rise. Diabetes actually is on a rise in this region. High blood pressure is on a rise in this region. If you analyze among the common causes of death here and mortality, morbidities, you find that diabetic related complications are actually also on a rise. So we also see non-communicable diseases are really on increase. One is I want really to appreciate, number one, the Ministry of Health, first of all, for considering Kapchorwa Hospital to benefit from this, for giving us a theatre. We're really very grateful, though we still have quite a number of things that we still need. So we still request Ministry of Health to also still consider us, because as the hospital is growing, currently we only have 2 general wards for patients where we mix both surgical and medical conditions. If ministry could think of also giving us constructing for us specialized units where we have a specialized surgical ward for internal medicine, medical wards, we could have those specialized units coming in. So we still request ministry to support us on that. But by and large, we are very grateful for the support that ministry has given us. Then to the Updf Engineering Brigade, also we send our appreciations to them for the professionalism that they exhibited, the teamwork. We were more like one people working together. There was nothing like fearing that, no, these are UPDF armed people. No, it has really been very nice. So I really want to encourage the UPDF team to continue with their professionalism and to carry on with the same spirit. Thank you.